Okay, so good morning, student, once again. So today, before starting the theory portion, so we will have this this extracurricular activities, okay, which will be performed by the Samsung Riang. So Samson, if you are comfortable, you can on your video.
Yes, ma'am.
The rest of you, please get ready, okay, every day, because yesterday I have mentioned the name and no one is getting ready. So if one is absent, then the other one have to perform. So next day, this Pohor, 3YEARS and Asim get ready next. On my next class, I mean. Okay, Samson, you can start now.
Yes, ma'am.
I think it would be best if you on your video. Okay, are you ready?
No, ma'am, wait for 1 minute, ma'am.
Okay, no problem. You take your time. Okay. Today, as we all have two class, now after this class, we again have practical class. So on practical class, before we start the practical class, Carly, would you like to perform? Carly?
Sure, ma'am. Yes.
Yeah, you perform in the next class.
Okay, ma'am.
Okay. Okay, so Samson, when you are ready, inform us, okay?
Yes, ma'am. Hello, ma'am. Can you see me?
Yes.
Um, I'm not actually a good singer, but I'll try to sing a song today.
Yes. Okay, no problem. Okay, just try it. Okay.
It's a country song by Brett Young. The name of the song is "In Case You Didn't Know."
Okay. Not bad. You can start now.
Yes, ma'am. I can't count the times, almost said what's on my mind, but I didn't, just didn't. Just do the ordinary. Wrote down all the things I say. I didn't. I just couldn't. Baby, I know that you've been wondering. So here goes nothing. In case you didn't know, baby, I'm crazy about you. And I would be lying if I said that I could live this life without you, even though I don't tell you all the time. You had my heart a long time ago. In case you didn't know. Way you look tonight. That second glass of wine. That did it. There was something about that kiss. Girl, you just me got me thinking. Oh, I'm thinking. All the things that I've been feeling. It's time you hear 'em. In case you didn't know, Baby, I'm crazy about you. I would be lying if I said that I could live this life without you, even though I don't tell you all the time. You had my heart a long, long time ago. In case you didn't know. Ma'am, that's all.
Oh God, you're too good. You're too good. Please give a round of applause for Samson.
Very nice.
Yeah, very nice, very nice, very nice. Keep it
Thank
up,
you, ma'am.
Samson. Okay, so that's all. Before we start the topic now, so some of the little activities that we could play upon each other now, so that you also you'll find little bit interest that, and then you can showcase your talent now in that way, so that we will come to know now who got what talent today. We came to know that Samson is a great singer. Is it, Samson?
Thank you, ma'am.
Next, in my next class, we will again see some kind of performance, singing, dancing, or whatever it is from Carly. And the other day, I really want to see Pohor performing on my on one day. I'll request you anytime. Okay, Pohor, get ready anytime. You just think yourself that you can be called anytime. Okay, Pohor.
Okay, ma'am.
Okay. I don't know why it seems like you have some hidden talent, That's why I have so much faith in you. Okay, so now let us start the today topic. Okay, so that day I have taught you all about the hemorrhage, so about the bleeding. So whatever the remaining portion it is, we will continue with that. We were discussing about the special forms of bleeding. We could discuss only one. So today, with how much we can, we will do it. And from on my next class, we will totally complete this hemorrhage. We will not come back. We'll try to complete it. Okay, so Jiban, till how much we have completed that day? That first 8 theory. Till how much we have completed that day? Do you remember? Jiban, do you remember? Carly, do you remember how much we have completed that day?
Yes, ma'am. Point number 5 of treatment, I think. Oh, no. All the treatment, ma'am.
It was oh, we have completed the treatment. Okay, means I think we have discussed special form of bleeding. The first point, that is bleeding from the scalp, right? Have I start
Yes,
the
ma'am.
bleeding from nose?
No, ma'am.
Excuse me, ma'am.
Yes.
Many students are having network problem today.
Today?
Yes, ma'am. Due to heavy rain, I think it would be best if we did revision.
If we?
Did revision, ma'am.
Oh, is it? Oh, but if we do revision, then okay. If they have heavy rainfall, then no problem. I will continue, and whoever could hear me properly, so we'll just continue on the the topic, and then I will be sending you all the link. Okay, and through that, when
Okay,
their
ma'am.
network is good, they can go through that link. Is it okay?
Okay, ma'am.
Because I really want to complete your syllabus as early as possible, so later on we can have a group discussion. So okay, so let's start. Okay, so today we will be starting this bleeding from the nose. You can write it down, the heading. First was bleeding from the scalp, and now it is bleeding from the nose. Is the screen visible?
Yes, ma'am.
Okay,
Yes,
please
ma'am.
listen carefully. Okay, I will be very fast. So bleeding from the nose. So bleeding from the nose, It is also known as what? Bleeding from the nose. उसका दूसरा medical term है. Anyone have any idea? Fast. Anyone have any idea? Bleeding from the nose. उसका दूसरा term medical term होता है. जैसे कि bleeding is also known as hemorrhage. Hemorrhage is also known as bleeding ना. In the same way, bleeding from the nose का भी दूसरा नाम होता है. Anyone have any idea?
Nosebleed, ma'am.
Pardon?
Nosebleed.
Nosebleed. Okay, bleeding from the nose, nosebleed. You write it down. Epistaxis. EPISTAXIS. Write down. All this I just no need to like type in the slide and all. Just write it down. Epistaxis. 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 So you can call bleeding from the nose as epistaxis. In simple term, you can name it epistaxis. Are you done? Shall I repeat or it's done?
Done, ma'am.
Done,
Okay,
ma'am.
epistaxis. Huh? Mat bhulna. In case in exam, if I will like tell you to write define epistaxis, वो epistaxis क्या है? पहली बार सुना. ऐसा react मत करना. So bleeding from the nose. So bleeding from the nose, it is most commonly occur when tiny blood vessel inside the nostril, that is inside the nose, are rupture. Okay. हमारी nostril के अंदर, हमारी nose के अंदर like बहुत सारा tiny छोटा सा blood vessels होता है. Okay. When these blood vessels are rupture, okay, then what happened? That it led to bleeding. So let me explain again. So when the tiny blood vessels which are present inside our nostril, if there occur a rupture in the tiny blood vessels, then that can lead to bleeding. Okay, or else either by a blow to the nose. Okay, either by a blow to the nose or as a result of sneezing. Okay, when we sneeze too much. Okay, when we sneeze too much, in that case also it can lead to bleeding. And then picking. I hope you know what is picking, etc. You have any idea what is picking? P-I-C-K-I.
Yes, ma'am.
Okay, picking, etc. So these are the conditions where bleeding can occur from our nose, that is epistaxis. So let me repeat again. Bleeding from the nose, it is mainly common. Okay, how it is common? When these small our tiny blood vessel inside our nostril are ruptured or damaged. Okay, are ruptured, then what happen? It can lead to bleeding. Or else if there is a blow to the nose, then can also cause bleeding. And if there is this bleeding can also be the result of sneezing, when we sneeze too much, or picking, etc. Okay, bleeding come from the nose is also a sign of fractured skull. So if there is a fracture in our skull, okay, अगर skull पे fracture हुआ, हाँ, तो उसका वजह से भी bleeding, nose से bleeding हो सकता है. Okay, if there is a bleeding or fracture in your if there is a fracture in your skull, that can also lead to like this means bleeding can also occur from your nose. So yeah, this is the introductory part of epistaxis, that is bleeding from the nose. Are you clear, all of you? If not, please say me now onwards. Are you clear? Bleeding cases?
Yes, ma'am.
Yes, ma'am.
Okay, let's move on.
Yes, ma'am.
Okay, symptoms and sign. Okay, if there is bleeding from the nose, or then what type of symptoms, sign and symptoms you could find? So there will be a moderate flow of blood from the nose. Obviously, अगर nose पे या nostril पे bleeding हुआ तो क्या दिखाई देगा बाहर से? There will be a flow of blood from our nose, is not it? So there will be a moderate flow of blood from the nose. And if the skull fracture is there, okay, अगर वो bleeding skull fracture का वजह से हुआ तो then there will be a mixture of blood as well as a clear watery cerebrospinal fluid. Okay, we call it a CSF fluid. That CSF fluid. So if there is a normal, like because of the rupture of the nose and all, then you can just find moderate blood flow from your nose. Okay, but if that bleeding is because of the skull fracture, then there will be both the mixture of blood as well as another watery fluid. That is another watery fluid is known as cerebrospinal fluid. Okay, so these are the symptoms you will find if there is bleeding from the nose. Are you clear?
Yes, ma'am.
Yes, ma'am.
Okay, let's move on. Next is what to do. If there is a bleeding from the nose, okay, what you need to do? So we should tell the casualty to sit down and tilt his head forward to allow the blood to drain from the nostril, okay? You have to tell the casualty to sit down. बैठने को बोलना है, okay? We have to tell the casualty to sit down and then tilt his head forward, means head आगे तरफ tilt करना है, okay? We have to like bend towards, we have to bend the head forward, okay? And when we tilt our head forward, what will happen is that it will allow the blood to drain from the nostril. So it will allow the blood to drain from the nostril, and we will ask him to breathe through his mouth, okay? This will have a calming effect, and to pinch the soft part of his nose for up to 10 minutes, holding constant pressure, reassure and help him if necessary. This how we can explain this in a simple way. Means first of all, if you find that someone is bleeding, okay, from his or her nose, then you should instruct that person to tilt his head forward, okay, and then to pinch the soft part of his nose, to pinch the soft parts of his nose. Why we need to pinch the soft parts of his nose? In order to stop the bleeding, okay? At least he need to pinch the soft parts of his nose for at least 10 minutes, okay? And then as he will totally close his nose, as he will totally pinch the soft parts of his nose and like of his nose, that means his nose is totally closed. So in that case, what happen is that you should advise, or you should like request him to breathe through his mouth, okay, through his mouth, and then and reassure and help him if necessary. And you have to reassure him that you are going to perform this, and this will help you in like in proper improvement, all these things. So wait, I'll show you all, okay, that how to till this one till. So tilting means like tilting forward means this is the soft part of your nose. Now this is the soft part of your nose. You have to hold it like this and like tilt forward. Little bit, you have to tilt forward like this. It's not like this, okay, not like this, not like this. This is like this backward. You have to tilt forward like this. Don't think that if you do like this, then so all the blood will flow. It's not like that, okay? So in that case, you have to like hold the soft part of your nose and then tilt forward like this, and then you have to like hold this pressure, okay, direct pressure, this for at least 10 minutes. You have to hold it. In that way you need to like perform. Are you clear?
Yes, ma'am.
Yeah.
Yes, ma'am.
Okay, done. Next point. Coming to the next point, we have to advise the casualty not to speak, swallow, cough, spit or sniff, since this may disturb blood clot that have formed in the nose. Because when there is excessive bleeding or when there is so much of bleeding, what happens? Itna zyada bleeding hone ka wajah se inside our nose there can be a blood clot. Okay, the blood can clot. So that is the reason why that we have to advise the casualty not to speak. Okay, while his nose is bleeding, you should advise him not to speak as well as swallow anything. Okay, to swallow anything, because like he might swallow this blood clot, na, so allow him not to speak. But bhi nahi karna hai, or not to swallow anything, as well as cough and then spit, like spit as well as sniff. You know now what is spit, what is sniff? Yes or no?
Yes, ma'am.
Yeah, spit
Yes,
or sniff. Okay, when you spit or sniff or cough, swallow or speak, what will happen is that this will disturb your blood clots. Okay, that is formed in the nose, which is very, very much dangerous. Okay, it can enter through your you can enter the blood clot if you like by mistakenly swallow. It will enter into your lungs, and this will create a difficulty in breathing. You'll have shortness of breath, which is very, very much like it's an alarming, it's a dangerous. So we should instruct him to spit out any blood in the mouth. Instead of swallowing anything, you have to advise or request him to spit out any blood that occur in his mouth. Okay. Then because swallow blood may cause nausea and vomiting. If you swallow blood, okay, like there is also another disadvantage is that if you swallow the blood, this will create an urge to like occurs in hours to do vomiting. Okay, nausea and vomiting bhi ho sakta hai. It can cause nausea and vomiting. And then and it give him a clear cloth or this tissue to move any dribbling. So you have to like give him any, if there is any handkerchief available or any cloths, any clean cloths, sterile clothes available, then you can give him, or any tissue available, okay, in order to move up any dribbling that occur from his or her nose. So are you clear with the second point? पहले तो tilt head था और दूसरा वाला तो speak, swallow, cough, spit, sniff, ये सब like करने में मना करना है. So you need to stop the casualty not to perform all this. So are you clear?
Yes, ma'am.
Yes, ma'am.
Okay, okay, let's move on. So moving to the next point, after 10 minutes, that means you should instruct the casualty to pinch the soft part of the nose. It's not at least for 10 minutes. So he already pinched his nose for 10 minutes. Okay. Then after 10 minutes, tell the casualty to release the pressure. Okay. If the bleeding has not stopped, tell him to reapply the pressure for 2 further period of 10 minutes. So at first you request him now that please pinch the soft part of your nose so that it will stop your bleeding. But after pinching the soft part of the nose, you find out that the bleeding is still like ongoing. Okay, the bleeding doesn't stop yet. So in that case, you have to again reassure him to reapply the pressure, to perform the pressure against at least for 2 further period, means at least for 2 more times. For 10 minutes, you have to advise him. And then next, once the bleeding has stopped and with the casualty still leaning forward, clean around his nose with lukewarm water. So now after pinching the soft part of the nose for 10 minutes, like you find out that the casualty is also still like tilting forward, still leaning forward. Okay, and at that particular moment itself, you have to clean the surrounding, clean the surrounding area of the nose. Okay, because if bleeding occurred, then obviously there might be some like might be like attachment of the blood around the nose, or that surround the nose. Okay, the surrounding part is part of the nose. So at that time, you don't directly clean with the water. Okay, you have to clean with a lukewarm water. So what is lukewarm water, Carly? LUKE.
Temperature is more than normal, ma'am, but not hot.
Oh, very good. Okay. Okay, it's like you can also simply call it as like moderately warm. Okay, it's moderately warm. You know now, mild, moderate, severe. Mild means thoda sa, like means
Yes,
moderate means it's okay. Severe means it's very, very much worse. So lukewarm water means it is moderately warm. So you have to clean with this lukewarm water, okay, the surrounding area, so that it doesn't create any kind of infections. And also you have to advise him to rest quietly for a few hours, and tell him to avoid exertion in a particular, not to blow his nose, because this could disturb any clothes. All these are like, oh, like there is all link or similarities between every single points. Okay, so what in the 4th point, what you just need to know is that once the bleeding stops, like tell the casualty to rest for at least a few hours, and then you have to clean the surrounding area. Okay, surrounding area while he is tilting forward. And then like you should advise him not to blow, because this could disturb any clots. So are you clear with all these 4 points? Yes or no?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, next.
Yes, ma'am.
If bleeding stop and then restart, help the casualty reapply pressure. So before like after like pinching the soft part of the nose, okay, the bleeding already stopped, but still after a few minutes or after an hour, it again restarts. At the time, you again have to request the casualty to reapply the pressure, because this reapplying the pressure or applying direct pressure upon the soft part of the nose is the best method for like for stopping the the bleeding that comes from the nose. So that is why even if it stop and comes or restart again, you still have to like advise him the same process to perform. So next, if the nosebleed is severe or if it lasts longer than 30 minutes, arrange to take or send the casualty to the hospital. So if the nosebleed is so much of severe, okay, it's so much of worse, it's worsening and worsening minutes after minutes. So if the nosebleed is severe, or if it lasts for longer than 30 minutes, then you have to arrange, okay, you have to send the casualty to the hospital or any nearby healthcare facility that is available. You have to send the casualty, okay, so that primary treatment can be performed over there until it gets like into a serious condition. So are you clear what you need to do when you find someone bleeding from the nose?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. So next, your aim. What should be your aim when you perform when you perform those like activities? Now, what is your aim? Your aim should be to maintain an open airway, because we breathe from when if there is any blockage in your nose, then it will be difficult for the air to pass. There will be difficulty in breathing. So you have to make your nose free, okay, you have to make your nose like you have to like clear your nose, okay, from any kind of blockage, okay, that can occur from blood clot. So to maintain an open air should be your aim. So Jeevan, please take attendance. Okay, next point. The next point is to control bleeding. Your aim should be to control bleeding. There are special case for a young child, okay? A child may be worried by a nosebleed. Tell her to lean forward and then pinch her nose for her, reassure her and give her a bowl to speed. It means like in case of the young children, in case of young children, if you find the young children that if their nose is bleeding, you have to like give them a bowl, okay, a bowl to spit out or to dribble into it. So these are some of the special cases which is not that much necessary, but in case if you want to know that. So next is bleeding from the ear, okay, bleeding from the ear. So these occur during skull fracture or rupture of brain. Suppose if this skull fracture is very much important, okay, because this skull fracture can cause bleeding from different part of the area, okay. So when there is a skull fracture, okay, bleeding can occur from your ear also. And if there is a rupture of the eardrum, क्योंकि ये eardrum का वजह से ही हमको सुनाई देता है ना, because of our eardrum. We have our eardrum too, that if someone speaks to us also, we could hear it. So if there is a rupture in our eardrum, then what happens is that can also lead to, or the occurrence that can also lead to the occurrence of bleeding from our ear. And if there is any external ear wound, अगर बाहर से externally अगर ear पे कुछ infection, कुछ injury या कुछ wound है, तो from there bleeding can also occur. And the other is if any infection, कान के अंदर बहुत सारा infection हो सकता है ना, if there is any infection from your ear, then that can also occur, that can also cause the occurrence of bleeding. And if a blow to the side of the head, and if a blow to the side of the head or an explosion, because if there is any blow to the side of the head, means at the like side of the head, if there is any blow or else explosion, because of any explosion, the bleeding can occur from the ear. These are some of the condition, okay, जहाँ पे means क्या का वजह से like bleeding हो सकता है. So this is how it can occur. One was the skull fracture. The other one is if there is any rupture from our eardrum, and if there is external wound, occurrence of external ear wound, and if there occurs any kind of infection from our ear, and if there is blow to the side of the head, then also bleeding can come from the ear, okay. And if there is any explosion, then also we can feel the bleeding that occurs from our ear. So are you clear?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, Jivan, are you done with the attendance? Jivan, are you done with the attendance? Jivan, can you hear me?
Ma'am, he said he's having a bad network connection.
Oh,
Yeah.
okay. Then Samson, please.
He took the screenshot.
Okay, no problem. Okay. Okay, so let's move on. There is only 5 minutes, but still I'll explain a bit more. Symptoms and signs. So what are the symptoms you can find? Okay, if there is bleeding from your ear. So if there is if from the eardrum, if there is any rupture from the eardrum, okay, what type of symptoms we can find? So there will be pain inside the ear. Obviously, if your eardrum is ruptured, then there will be pain inside your ear, and then there will be deafness. Deafness means, deaf means what? Like deaf means like you're totally deaf, you could not hear anything, okay, if someone spoke out. So that is deaf. So deafness is very, very dangerous if there is any rupture from the eardrum. Okay, so deafness, pain in the ear, and moderate flow of blood from the ear. Obviously, if there is any rupture from the ear, then like the flow of the blood that comes out from the ear can be seen. So if from within the skull, if there is any fracture from the skull, okay, and at that time what happened is that we could see the history indicating skull fracture or head injury. Means history indicating skull fracture or head injury. And the other one is headache and small amount of blood which is mixed with clear watery cerebrospinal fluid may be coming from the ear, because like it is fracture from the skull itself now. So the fluid that will come out from the ear, that fluid will not only contain blood, okay, that blood will be mixed with the clear watery fluid that we call it as cerebrospinal fluid. In short, you can call it as CSF. CSF in capital letter, you can just write it down, CSF. CSF ka matlab hai cerebrospinal fluid. Okay, this fluid it used to mix with blood and it comes out into our ear if there is any rupture that occurs in our skull. So are you clear with the sign and symptoms? Means if there is any rupture in the eardrum, what sign you will see? If there is any rupture in your skull, what type of like sign you could find that comes out from your ear? Means the bleeding that comes from your ear. Are you clear?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, and there can also occur unconsciousness. Okay. Okay, next, what you need to do? Oh, there is no more time. Okay, still, what to do? We have to place the unconscious casualty, a conscious casualty in a half sitting position with the head tilt to the injured side to allow blood or fluid to drain from the ear. Means like you have to place the patient, okay, we have to place the injured person in a half sitting position, not totally sitting, okay, thoda sa bend, like half sitting position with the head tilt to the injured side to allow blood or fluid to drain from the, means like from the affected ear, okay, from the the injured side, you have to like you have to let this casualty to sit in a half sitting position, okay, so that all the blood or any fluid that is being accumulated, okay, it will help to drain out from your ear. So that was the first one. Next, hold a sterile dressing or a clean gauze pad lightly in place on the ear and do not plug the air. Means you have that particular like fluid that will drain out from your ear. Now you have to hold that fluid from with the help of this gauze pad or else any sterile dressing, whatever like articles that are available, okay, and you have to slightly place on the ear. You don't need to give so much of pressure, and then always remember that do not plug the ear. This can also be harmful. And then send or take the casualty to the hospital. So if the condition is very, very much serious, now what you need to do is that you have to send or take the injured patient or in the casualty to the hospital. And next, you also have to check the breathing rate, breathing pattern, and the level of responsiveness at 10 minutes interval. After every 10 minutes, okay, you have to check that the patient is breathing properly or not, if you have any shortness of breath or not, and if his level of responsiveness, you will call out his name, and then if he could respond it back, he could be able to respond you back or not, that his level of consciousness, his level of responsiveness, you have to assess, okay, within 10 minutes of interval. And then if breathing and heartbeat stop, begin resuscitation. Means like you have to give that oxygen pump, okay, if the breathing and the heartbeat stop. You have to give resuscitation. And here also your aim should be to arrange transportation to the hospital. So that was all about this one, okay? Epistaxis as well as bleeding from the ear. There is only 1 minute left. It's no more time. So you all of you understand whatever we have discussed now? Bleeding from the
Yes, ma'am.
bleeding from the eyes,
Yes, ma'am.
ear, as well as
Yes, ma'am.
bleeding from the nose. Okay, then that's all for today. Okay, I will inform you all when to join the class, next class again. Okay, then thank you, everyone.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.